Hi, my name is Lisa Nunes, and this is my presentation on my spider map concept map of the social determinants of care and how they all connect for the U.S. healthcare system. This map will show how different parts of our lives, like where we live, how much money we make, and who we know, all come together to not just shape our individual health, but the health of the entire country, and how taking a holistic approach while examining the U.S. healthcare system can help strengthen it overall. In the very center of my map, we have the bubble that says US healthcare. This is the main focus that all the other pieces will connect to. This is an important part because each determinant isn't just a standalone factor. They all influence each other and work together, and it can either overall strengthen or weaken the US healthcare system, depending on the rankings and which way the country is going. Starting on the left, we'll look at the first bubble that has socioeconomic status. This refers to how much money someone makes and their overall financial stability. The data from odph.health.gov says 1 in 10 Americans live in poverty, and this affects healthcare in multiple ways. Typically, people with more money have better access to care, with either being able to afford seeing their doctors or specialists more frequently or being able to go to privatized for profit health institutions. In the US, for profit privatized health institutions typically have better resources, more technology, and better access to provide care to citizens versus the public or county funded health institutions. Another concept is people with more money or are in a higher socioeconomic class have more food security and can afford healthier food, which in the long term helps prevent health problems such as heart issues or diabetes. For those in poverty, it's much harder to get the care they need, and it drags down our overall healthcare rankings. Referencing how socioeconomic status is connected to access to care, um, the Commonwealth Fund ranks the U.S. as the last country in their rankings among industrialized countries for access to care, showing just how much income disparities can impact health outcomes. Staying focused on the bubble that says access to care, which is all about how easy or hard it is for people to get medical help. According to the Commonwealth Fund, long wait times, provider shortages, and high costs are common barriers. And here's how it ties together. Um, if someone is living in a lower socioeconomic class or poverty, they're less likely to have good insurance or able to afford out of pocket costs, making access even tougher. This directly affects our global healthcare ranking and shows how socioeconomic status and our access to care are deeply connected. Shifting over, we're going to take a look at the bubble that ranks education. The OECD ranks the US 28th in science overall and 37th in math. Education influences health in ways people might not understand. Health literacy is how people understand medical advice, how to be compliant with medication instructions or their self care instructions. A lack of knowledge can lead to worse health outcomes and can even keep people stuck in poverty, creating a cycle that connects right back to the socioeconomic status. A lower socio a lower income level means lower socioeconomic status, which means reduced access to care and more than likely reduced access to education. So when the people living in poverty are able to access healthcare, they might lack the health literacy to capitalize on their instructions or their understanding for healthcare, overall reducing their capacity to have a healthier lifestyle. The next bubble, we see physical environment. This is about the places people live, focusing on are they safe, supportive, or are they dangerous and unhealthy. According to Healthy People 2030 in odph.health.gov, people in safer neighborhoods tend to have better health overall. it says that it just provides a healing environment for people to be able to focus, rest, recover, and overall reduce their stress. Less stress equals better health. While looking at the Global Peace Index, the US ranks 132 out of 163 countries. This means that many areas across the US are considered unsafe or unstable from a global perspective. This connects back to socioeconomic status because poorer neighborhoods often have higher crime rates, worse housing, and less access to healthy foods, sometimes even being in areas considered a food desert. All these things work together to lower the overall health outcomes and push the US further down on global rankings. While taking a look at employment, having a stable job can be the difference between thriving or just getting by for citizens living paycheck to paycheck. Steady work is more likely to have health insurance, better food, or safer housing. When looking at the unemployment rate in 2024, the US's rate was 4.1%, ranking 72 out of 202 countries, according to the CIA. Connecting back to socioeconomic status, people without jobs are more likely to be in poverty. Again, connecting back to access of care, this limits their choice to health care and creates a domino effect that affects everything from education to physical environment. Next, we're going to look at the social support network. The people around us who can step in when things get tough. This is where people can lean on others, whether it be peers, friends, or family, or their community overall, to help them with support, stress from day-to-day life. The World Happiness Report ranks the US 12th globally for social support. This means we're doing all right, but there is definitely room to improve. Social support can buffer the impact of all other factors. For instance, someone living in poverty might have better health outcomes if they have a strong network of friends or family to help them out. But without the support, the negative impacts of poverty, lack of education, and unsafe environments can pile up, making it harder for people to recover and stay healthy. Also connecting back to physical environment, if neighborhoods are unsafe or do not allow for people to stay connected, this can diminish social support. Overall, this web shows how each of the world rankings are influenced from each determinant of care and how each determinant of care works together to create a cyclical approach for US healthcare. Now, why this format? I chose a spider chart because it shows how all these factors connect back to the main issue, US healthcare. Each leg or arrow of the spider represents a different determinant, but the real power comes of this format is how it connects all the factors back to the middle. They work together and influence each other. Each determinant of the main leg, or how each web from each of the determinant bubbles shows the different information and how it's relevant to each other. For example, if someone's unemployed, focusing on the employment bubble, they're more likely to live in a safe area, which refers back to physical environment, and they'll have limited access to health care. Access to care is referenced here. By organizing it this way, the chart makes it easy to see how improving in one area, like education, might potentially improve multiple other areas, creating a ripple or domino effect that can affect the whole US healthcare system, while still showing the complexity of each issue that while just fixing one determinant might not fix the system overall. Thank you for listening.